Value-based care, I think it's easy to say, is here to stay, but the reason I would say that is because I don't think quality of care is ever not going to matter.
Revere Health's commitment to value-based care is long-lasting. We're starting to think about things in different paradigms than we have in the past. I think it's important, though, that the doctors, physicians, science is at the forefront of those initiatives as opposed to simply being driven by business models.
The things that attracted me about Revere Health was, first of all, it was a multi-specialty clinic, so we had a lot of flexibility and versatility in who took care of our patients. I could send them to people I know and trust and knew that they were going to get appropriate care. The second thing is that it was still a physician-owned organization, which is becoming increasingly rare.
Value-based care and ACOs are directly aligned. As an ACO, it does drive together, and we have to come up with a common set of goals where we're trying to say, okay, for this patient from every specialty, here's the things that are important.
So even though we have, I call it this oversight of administration that I always joke, make sure that we're not breaking any laws, I can still be independent in my practice. So if I want to see patients 4 hours a day or 14 hours a day, 4 days a week or 7 days a week, whatever it is, I have that independence to make that decision for myself.
The culture at Revere is very independent. For me, that was a nice model because I want to be able to understand and have input and control both how much I work, the expenses that I do, the equipment that I'm able to get, but at the same time, I didn't want to deal with the regulatory burden of having to deal with all of the commercial and government payers and all the fun things that go on there.
Even though Revere is a pretty big clinic with a lot of providers, it's really easy for us to go over and meet face-to-face. Like if I have a problem with my computer or with the medical record system, instead of calling somebody up on the phone, I know exactly where I can go.
There's opportunities. I mean, any physician here, essentially any physician here, could walk into most of the departments and say, I'd like to get involved in what's going on. I'd like to be on your committee or whatever, and that could easily happen. People that want to be really involved in the political and administrative part of medicine, I mean, it's probably easier to get into that here than any place I've ever been.
Marketing is great. So when we start building a new practice, you get to go talk to marketing and they set up a whole plan for you in regards to getting your information out there, getting you out into the community.
One of the things that marketing has done is set up lunches out throughout the community for me. And I think every office we've gone to where we've had a lunch at physicians' offices, they've had the person accompanying me knows everyone by the first name usually and asks about family members and things. And so as far as physicians in the area, they're very well connected.
Revere owns all of our own real estate, and so we can buy into the real estate investments, which is absolutely the best investment any of us ever see compared to the open market.
In my setting right now, I designed the entire clinic that I work in. Where the rooms are, how big they are, the lab space, the protocols, everything there that I wanted to, I was able to design. But for me, that was actually a really neat part of the whole thing, is I feel like I own it.
We don't have to do the payroll, we don't have to worry about doing the financials. I mean, that's all done for us through our administrative teams, both in the departments and then at the business office level. Some of this is because of Revere Health, and some of this is because our CEO is phenomenal. He doesn't know just how to run business, but he knows how to run a medical system.
There are ancillary income streams that individual physicians practicing in a standalone sort of a setting can't enjoy. And the ability to be invested in the bricks and mortars to some degree of the clinic and the buildings and what we have here. And I think there's a sense of camaraderie, and I think that's one of the things that I like most about being a part of Revere.
There's both pros and cons to things like shared saving programs. The hard part for a physician is a lot of these things are decided by, say, the insurance company, whether that's Medicare or whether that's one of the big commercial insurances in your area. The nice part at Revere is we are starting to try to push back on some of those to some degree and say, hey, that doesn't make sense. Please help us to do a better metric.
Everyone has a role and does it well, and they're responsive so that I can focus on being the physician, and they take care of all the other things for me.
it's a wonderful place to work with people that I admire and respect.